most people will blame their pain or their problem on their age, the past experience they've had, a wreck they've been in, a sports injury, something that's happened in the past, overuse. They'll blame it on their body, their genetics, the body they're born with, their family history. And though those things may be factors, there are also 3 factors that you can't change. There's nothing you can do about it. You can't make yourself younger or change the past or trade in your body for a new one. Weight is sometimes mentioned, and sometimes that is a factor in the way that it puts more stress on your joints or changes the way you move. But that's the hint, though. The last factor that's really overlooked in orthopedics is the way people move. And it's partly because your doctor, your medical doctor, is not an expert in movement. They're an expert in identifying diseased tissue or pathology and trying to manage that in a medical model. Whereas physical therapists are in a prime position to correct the way you move. We are experts in orthopedic movement. If you consider a door with its 3 hinges, and they each are designed exactly the same, they're identical hinges, and they all support the door. And if that door swings on those hinges and it's lined up just right in the frame, it should latch just perfectly and shut for you. Most people, I think, have seen a gate that's a heavy gate that's maybe kind of sagging on its hinges, and then it won't latch correctly. The latch isn't necessarily broken. It's often that the hinges are worn out, or maybe they're pulling out from the wall. But let's maybe create an orthopedic problem for the door. If we loosen the screws on the top hinge and on the bottom hinge, and all that stress is on the middle hinge, what'll happen to it? It's pretty clear in that scenario. It's pretty simple. That middle hinge is going to wear out. And if the door went to the door doctor and says, "Hey doc, my middle hinge is killing me," the doc's going to look at that and say, "Oh yeah, look at this. I just took an image. You've got degenerative hinge disease." And you see where I'm going with this? The problem, the pain, the source of the pain is that door's middle hinge, of course. That's where the breakdown is. That's where the load is, the stress point. But the source of its problem are really that the top and bottom hinges are not supporting the weight of the door like they should. And so you've got 3 options in medicine that are typically used. You've got some sort of activity avoidance or protection of the joint. You're gonna splint the joint, cast it, tell the person, "Hey, you're benched. No more basketball for the next few weeks," or don't lift, don't bend over, don't twist, whatever it may be. And though that may be wise for the door to stay shut while its hinge heals a bit and you take a load off, it's not going to change its mechanical problem. And so when it starts to open and close again, it's going to have the same problem return. And that describes a lot of cases for you out there, whether it's your back or your knee. The next tool that a doctor has is to squirt a little WD-40 in there, some sort of symptom-focused remedy. Typically medicine. In physical therapy, in my profession, it's ultrasound or a hot pack or a cold pack. Some electrical stimulation, something that focuses on the symptoms that are involved, or the inflammation, I should say, that are involved in the healing process. Again, it's a cover-up. It's a comfort measure. I'm not saying don't take medicine that your doctor's prescribed, or don't use a hot pack or a cold pack. If it helps you, great, use it. But it's certainly not going to fix the problem. And the last option in medicine is to do surgery. Well, you got to replace that hinge. If you want to avoid surgery, though, or perhaps if you just want to really take care of this in a more natural or holistic way, let's look at the whole picture. If I screw the hinge back in on top and on bottom and immediately take a load off that middle hinge, that door is going to say, "Wow, my middle hinge feels better. The pain's still there, but it feels a lot better." And it's because we've changed the mechanics. And that is, in a sense, the door hinge theory that we apply to orthopedics here at Mission Physical Therapy. The parts have to work together appropriately. And you can get some amazing results when you start to look above and below the area where you hurt to see what hinges are not functioning correctly and what can I do to change that. More on that later. I'm Benjamin Hill with Mission Physical Therapy.